Good evening, welcome to the Board of Health for December 8th, 2025. I'll start with introductions. I'm Michael Roach, the chairperson. Sheila?
I'm Sheila Peralt.
Carol?
Carla Page.
Echo.
And I'm Carrie on behalf of the director.
I'm Andy Kinney, the new admin.
Welcome.
Thank you.
Nice to meet you. Nice to meet
Yeah,
you.
nice to meet you.
Hey, good notes.
I used to do this 11 times a month, so.
Okay.
Oh, wow.
We'll try to be loud. All right, so we're going to open the meeting with citizens in business time. Citizens or business owners may address the Board of Health on matters of interest to the public for not more than 3 minutes. Okay, let's stop right there. No citizens or business. We'll move on to the second item on the agenda, which is 52 Patriot Road, Lot 4 variance requests. There's a withdrawal of the variance request. Okay.
So it's just have to open the meeting and then vote to accept the variance and then just kind of close it.
Okay, so we'll hear a motion to accept the variance.
Yep, I make a motion to accept the withdrawal of the variance at 52 Patriot Road, Lot 4.
Is there a second?
I'll second.
Okay, Echo second. Any further discussion? Seeing none. Okay, Carla? How do you vote?
In favor.
Sheila?
In favor.
Echo?
In favor.
And I am also in favor. Okay. All right, third item on the agenda is Health Director updates.
Okay, so I don't have much to update either. So we got a new administrative assistant, Amanda. She goes by Mandy Kenny. This is literally her first day. She came in this morning.
Oh, nice.
Yeah.
Welcome.
Isn't she nice to make her come to it?
By the way, you're working tonight.
Yes, well, no, she was very excited and she wants to meet all of you guys, so I was like, okay. Amanda, you wanna tell the board a little bit about yourself?
Sure. I worked at McLean Hospital for 21 years. I got laid off in March. I kind of enjoyed not working for a while. Coming up on 9 months of not working, and I thought, okay, I think I need to get back out there because I'm pretty bored at this point. I worked for 7 chiefs at McLean, including the chief medical officer of the hospital. I worked for the president when his assistant was out. I enjoyed everything I did there, and I was devastated when I got laid off.
Oh. Sorry to hear that.
Yeah.
So you gotta.
I was promised I was safe, so it was really a slap in the face when
Yeah.
I was called into the office and I was like, you told me
I
I was
was
safe.
yeah.
So, it was hard.
Yeah.
And I mean, I absolutely loved everyone I worked for, and that was the hardest, saying goodbye to them, so.
Yeah.
But I
Like
stay in
you
touch
did
with all of them.
a long time. You worked, you said 21 years?
21 years.
Yeah.
Yeah.
It's easy to leave on your own
It
accord
is.
than it is.
It really is. But I do stay in touch with all the people I supported there. We're actually all getting together next
Oh,
week,
that's
next
great.
week for
That's
dinner,
good.
so,
That's good.
That's nice.
yeah.
Yeah.
And you have understand a little bit of the health background as well, because you work with that.
I worked with DMH, DPH, like I
Awesome.
did all the reporting of all the suicides and death within 30 days of discharge and any incidents that happened. So I mean, I pretty much have done all the reporting with DMH and DPH, and when they show up unexpectedly to their survey, that I've worked with them very closely.
Excellent. Welcome.
But this is a big change from what I was doing, so it is a
Mhm.
big learning experience on this end, because I dealt with more mental health than I did anything else,
Right.
so.
Excellent. Well, thank you. Welcome, and
Thanks.
anything we can do to help, let us know.
Yeah. So Amanda's gonna be starting part-time and then she'll do full-time comes April 5th. And
April 5th or
January
Sorry.
5th. I'm like, wait a minute, no,
Hold on.
January.
Well,
Why
it
am I
does say
thinking
the next
April?
meeting is December 8th too down here.
Oh, I didn't change
Next,
that.
next meeting's today. Check.
Actually, that segment's extension from, basically December 31st to the 22nd of, January. So,
12/31
Yeah.
to 1/22, okay?
yeah, so, at this point, I think if we don't have anything important, maybe we don't have to have the next, meeting, unless something like, important comes up and we need to have a meeting. I think Mandy has been, I think doing a lot of meetings that she may be comfortable enough to do. I leave her with all, I think, I'll check my email and all the backup plans that, I usually have in place when I go, on vacation.
But let's,
Mhm.
let's make like that meeting like an emergency meeting. Like, it would have to be something that needs to be passed before our next meeting. Some type of variance, but like, if it can wait like a,
Till February.
yeah, like,
Yeah.
if it can literally wait till February versus like, I don't think they're opening up much septics
No.
now,
No.
in the middle of the
No,
winter, so.
yeah.
I,
Yeah, usually it's just variances that I think come in that really require your attention.
Yeah, I basically, I don't want like any variance to request to come in, and then we should,
Exactly, yeah, okay.
we need to meet, it should be like, no, because it cannot absolutely wait, because it's a detriment to the whatever, then we can reconvene.
Okay.
That sound good?
Yeah.
Give you your time off. Anything with like inspections and stuff like that, if,
Yeah, so as far as inspections, we do have, a company that do inspections for
Okay.
us. So, I've been sending them like for the food establishments to, for them to be inspected. So they've been staying on top of it. I have asked, Ashley, she'll spend more time, in Tyngsborough just to, help out. And then we also have the senior work-off who's gonna be coming back in January. She
Oh,
works
okay.
once a week and she's wonderful and she's like pretty familiar. She's been doing this for us for like a few years now, so, she's really good as well.
Okay.
But as far as food inspections, I think we're good. Anything septic, Matt can, take care of it, yeah.
yeah, I think the biggest thing is only once in a while I can call from the fire chief or the police to
Yeah.
get a business back up and running, but they can wait till the next, I think till the next day, so I may call the office and say, I got a call last night, they wanna send somebody out to Smoky Bones to inspect
Yeah.
before they open.
Yeah.
Okay,
Again, that might be the only,
so an inspection as well as a variance would qualify for an emergency meeting?
inspection should just
Depending on
be
what it
like
is.
the next business day
Okay.
type thing.
Okay.
Variance would just be because it can't wait till February meeting.
Okay.
Okay. So you're saying a variance would constitute as emergency and have to have.
No, it'd have to be like a variance, but then on top of that, that particular variance
Can't
has-
wait.
can't wait till the February meeting,
Okay, yeah.
you know, because of some, I don't know what would be the reason. They gotta do an emergency septic repair or something, I don't
Yeah.
know.
Usually for an emergency septic repair anyway, the health department can approve it without coming before the
Correct.
board. Yeah.
Yeah, exactly.
Yeah.
Then that would be,
Yeah,
that could just be done by the health department, you don't need to call us in for that,
okay.
yeah.
Would there be anything else that would like require an emergency meeting, just so like I can have it in like the back of my head?
You can always check with Michael and I if you
Okay.
think something comes up.
Okay.
And that might constitute a meeting, and then we can help you and
Okay.
say yes or no. Like,
Okay.
you can call him first, and if he doesn't answer, you can call me.
Okay.
Yeah,
I
yeah.
was just thinking, what, yeah, because, what about like that one issue that we had on Danforth?
I think we should be fine, I think we're,
The police and the fire should
Yeah.
handle a lot of that
Yeah.
stuff, it doesn't, I don't think we need,
but we can make a decision if
Yeah.
we have to.
Okay, thank you.
Let's put it this way, we're always available on our meeting days should we need to come in.
Okay.
But then just reach out to either Mike or myself.
All right, sounds good,
and
thanks.
confirm. And the same way, if you have any questions, and there's nobody else around,
Yeah.
you can call
Okay.
him or myself.
Yeah,
Yeah.
maybe have some history.
Sheila has been, on the Board of Health for a long time.
20
Okay.
years.
Yeah.
Okay.
Yeah.
Yeah, so she knows a lot, and Michael has been on the board for not quite as long, but for a very long time too.
Okay.
So,
Yeah.
All right, thanks.
Anything else?
No, I think that's it.
Good.
Mhm.
No? Next would be meeting minutes for approval, November 10th.
I got the date right.
Yes.
So, for those, meeting minutes, in front of you, the only thing it doesn't have was there's an attachment, the one that I sent you, the, slide presentation
Oh.
by Mass DEP.
Yeah.
That was attached and was sent to you, but it was like 30 pages long, so, I didn't print that out.
Oh,
but
okay.
It's,
That's fine.
if you need to review it, I do have it up here.
No, that was really helpful last month when they were going over.
Yes, because it
Everything.
actually answered a lot of extra questions that I was thinking about.
Yeah.
Especially the map of where things were. That was
Yeah,
actually
Yeah, it
yeah,
was
to
helpful.
see.
Yeah.
And then like to see what they found too. And this is more of like, I think they consider it hazardous waste than like a water issue. It has to do with like, I guess overseen by, the, water or the, water regulation. If that makes sense.
make a motion to accept, the meeting minutes of November 10th, 2025.
Seconded, okay. Any discussion? Good, okay, Echo, how do you vote?
In favor.
Sheila?
In favor.
Carla?
In favor.
I'm in favor as well. That passes 4-0. Okay, moving along. New business. Old business. No business. All right, I guess, we can call it adjournment.
I make a motion that we adjourn the meeting at 6:30.
Yep.
I'll second.
Seconded by